Imagine walking down a narrow street in London in the mid-19th century. The air is thick, heavy with soot and a constant stench. Piles of garbage line the sidewalks. Children play near open ditches where sewage runs freely through the streets. At every corner, street vendors share space with carts pulled by skeletal horses. This is the living portrait of an industrial city in expansion, a place where progress and misery exist side by side. But something invisible moves through these streets, a silent threat that does not come from the air, but from the water. A threat that in a matter of days can turn an entire neighborhood into an open-air cemetery. Cholera. In 1854, in the heart of the Soho district, an apparently harmless water pump became the epicenter of a tragedy. Entire families were wiped out. Doctors and authorities, powerless, clung to confused theories about pestilent air and deadly vapors. But one physician dared to challenge the dominant explanation. His name was John Snow. By following the trail of death, he uncovered something revolutionary. The true source of the epidemic was hidden in what everyone believed to be the source of life itself: water. Before modern science, a simple water pump could kill thousands. This moment marks the beginning of one of the most important turning points in the history of public health. Cholera was not merely a devastating disease. It was the spark that ignited an urban, scientific, and political revolution, a revolution born out of horror. But how did a single epidemic force entire cities to rethink basic sanitation? How did mass suffering give rise to modern epidemiology and the public health systems that shape the world we live in today? Prepare to discover how cholera exposed the inner workings of a failed urban system, and why its story remains as relevant today as it is disturbing. At the turn of the 19th century, the Industrial Revolution was in full swing. In just a few decades, cities like London, Manchester, Paris, Hamburg, and Stockholm ceased to be administrative and commercial centers and became massive engines of production. But this rapid growth came at a cost, a population explosion driven by the mass migration of rural workers turned entire neighborhoods into unsanitary labyrinths. Houses were built on cheap land with no planning whatsoever. In London, for example, the population is estimated to have jumped from around 1 million inhabitants in 1800 to more than 3 million by the middle of the century. This new urbanization, however, was not matched by adequate infrastructure. On the contrary, in many working-class districts, hundreds of people shared unpaved streets with no sewage systems and no regular access to clean water. Water was drawn from shallow wells, often dug beside cesspits or streams contaminated by human and industrial waste. Open sewage flowed through improvised channels. Rivers like the Thames in London became massive dumping grounds for garbage, feces, and animal carcasses. It was the perfect environment for a public health catastrophe. The third cholera pandemic, which lasted from 1846 to 1860, had the widest reach and the greatest impact. Although Europe had already been struck by earlier outbreaks, it was this third pandemic that changed everything. The disease, originating in South Asia, spread rapidly along maritime and commercial routes. Infected ships left the Bay of Bengal and arrived at European ports carrying, along with goods, an invisible enemy. Russia was hit first, followed by Germany, France, the United Kingdom, and eventually North and South America. No continent was spared. In London, one of the deadliest outbreaks occurred between 1848 and 1849, killing roughly 14,000 people in just a few months. In Stockholm, the outbreak of 1853 left more than 3,000 dead in a city that at the time had only about 90,000 inhabitants. The speed of transmission and the brutality of the symptoms terrified even the most experienced physicians. Someone healthy in the morning could be dead by nightfall. Extreme dehydration turned the skin bluish, making the bodies instantly recognizable. Fear spread faster than the disease itself. In the absence of solid scientific knowledge, confusion reigned. The dominant theory of the time was the miasma theory, the belief that diseases were caused by foul air arising from decomposing organic matter. Since industrial cities were filthy and foul-smelling, this explanation seemed logical. Journalists, doctors, and authorities reinforced the idea that bad odors were the real enemy, and this belief shaped public policy. Streets were cleaned, windows were opened, lime and flowers were spread to purify the air. Doctors carried perfumed handkerchiefs. Residents burned herbs inside their homes. In Paris, authorities even deployed armies of cleaners to disinfect the air, while completely ignoring the quality of the water people were drinking. The result was tragic. While the wealthy fled to the countryside and escaped the worst affected areas, the poor died by the thousands, trapped in neighborhoods with no alternatives. Many barely knew what clean water was. In Stockholm, newspapers of the time described scenes of despair, carts carrying bodies through the streets, churches filled with grieving families, hospitals turning patients away for lack of beds. Amid the chaos of the 1854 epidemic in London, one solitary doctor challenged the consensus of his era. While everyone pointed to putrid air as the cause of cholera, John Snow pointed to the ground, specifically to the Broad Street water pump. Using a rudimentary map and data collected door to door, Snow showed that most deaths were concentrated around that pump. When the handle was removed, cases dropped dramatically. The connection between contaminated water and the spread of cholera was suddenly undeniable. Even so, the miasma theory was too powerful to collapse overnight. Official science, newspapers, and politicians still preferred to fight smells rather than the structural causes of contamination. But the seed had been planted. Snow had given public health a new tool, data-driven observation. Today, his work is considered the birth of modern epidemiology. As outbreaks continued and urban systems collapsed, reforms became inevitable. In London, engineers like Joseph Bazalgette built modern sewage networks beginning in the 1860s. Similar transformations occurred in cities like Stockholm, which after the 1853 outbreak completely redesigned its water system, drastically reducing cholera cases. Inspired by Snow's methods, urban planners began to see cities as interconnected systems, where water, sewage, housing, and health were inseparably linked. A new approach to urban planning was born, one based on prevention rather than treatment alone. Cholera did more than claim lives. It exposed the deep contradictions of industrial progress, a promise of modernity built on neglect of the poorest. By revealing that diseases follow patterns, John Snow taught us that epidemics are not acts of fate. They are social failures. And even today, in slums, refugee camps, and regions affected by climate disasters, the same dilemmas persist: contaminated water, lack of sanitation, political indifference. The ideas born in 19th century London still echo in vaccination campaigns, public health policies, and emergency responses to global outbreaks. As one contemporary researcher wrote, Snow did not merely discover the source of cholera. He taught us how to see the city. And if we were to face a new urban epidemic today, would you know where your Broad Street pump is?